Loren Bast, who is the executive director of Bainbridge Prepares, is with us, and he is, along with Bainbridge Pharmacy, have been working to coordinate a number of volunteers, medical volunteers and others, to get vaccines to people, and they've been following the guidance from the county. So I wonder if, Loren, you could start us off to tell us just a little bit about how the last couple of weeks have been going.
So I'll back up and kind of indicate how why the heck we are involved in the vaccination rollout. So we, Bainbridge Prepares had been working throughout the pandemic with community pharmacy. Mark and his family were just wonderful partners for a variety of things. You know, we'd get them, you know, sanitizer, and they'd help distribute masks when we'd, you know, have extra masks. And, you know, he and I were working on, you know, emergency backup power so that prescriptions don't spoil in the event of a power outage. Not sure how many of you just experienced that last night. So he and I had been, you know, kind of checking in every few weeks. And then when I knew the vaccines were going to start rolling out, you know, basically in mid-December, I reached out to him again and said, "Hey, Mark, you know, if you need assistance, if you're going to be a vaccine provider and you need assistance in distribution, let us know." And it was funny, about a week later, I was actually recovering from some eye surgery, and you know, lying face down on my bed, and he calls and says, "Oh my God, Loren, we're about to get 300 vaccines tomorrow, and I have no way to administer that many, and we want to get them out before Christmas." You know, we did not want them to sit. And so, you know, I called up, you know, all of our partners in my team and Ann with the city, and I said, "Oh my God, we have to, you know, find all the 1A folks that we can and get shots in arms over the, you know, the next few days." So, you know, we had already been maintaining a list of healthcare providers and working a lot with them throughout the pandemic, you know, dental offices and clinics, and, you know, especially places like Bainbridge Senior Living, where Morgan and I are texting each other about 5 times a day, and said, "Okay, how many people can we get signed up?" So we were able to get 307 individuals vaccinated on, you know, again, less than 24-hour notice, Christmas week. And that was, over 100 of Bainbridge Senior Living staff, and a lot of firefighters from both Bainbridge and North Kitsap, and you name it. And so essentially we have now vaulted to the second place in the county in terms of total vaccine administration, after St. Michael's Hospital. So I believe last week we did over 400 on the island, and then another few hundred up on Port Hadlock in Jefferson County, because Mark also owns the Tri-Area Pharmacy up in Port Hadlock in Jefferson County. So we are assisting him up there as well. So doing everything we can to get shots into arms.
So the pattern has been to try to figure out, obviously the state has given some guidance about who in what order. That's not essentially your decision, right?
So I'm glad you asked that question. So the guidance is very, there's a lot of gray area in the guidance. So if you are a respiratory surgeon deep in a COVID unit at a clinic or a hospital, then absolutely, man, that is a 1A category. But we have waded into all of the gray area of what is 1A. So, you know, is a marriage counselor healthcare? Are they 1A? Is a veterinarian 1A? Are informal caretakers? This is a big one that aren't licensed healthcare providers, but they take care of, their husband who has Parkinson's or whatever, are they 1A? And this became such a problem for us that we developed essentially a eligibility Supreme Court, where we have a small group of individuals that I can transfer the decision-making process of eligibility to. And so it's a former member of the City of Bainbridge Ethics Board, as well as 2 members of the Bainbridge Fire Department that are kind of doing the thumbs up and thumbs down when we get a request for an appointment from somebody that may not fit into that 1A category.
And I just want to jump in here to say, nobody thinks that there is a person that doesn't deserve to get the vaccine. I mean, we all deserve to get the vaccine. It's just a matter of trying to, in a systematic, fair way, move through the population from highest risk, or at least highest exposure, to less risky situations where maybe we have the control to be able to isolate ourselves more, so we might be willing or able to wait.
Correct. Yep.
So just to talk a little bit about that. So you are continuing to try to evaluate this on a case-by-case basis. You've got a team that's working on that. How does somebody who is on this call know whether they qualify as a 1A? And of course, then the next question is, do you have a sense of the timing of when the next group 1B will show up?
So if you believe you are 1A, you are welcome to try to book an appointment. And so 1A is essentially, a resident or staff member of a senior living facility or assisted living facility, healthcare worker, emergency responders. And Sandra, I'll get to your question in a second. And I will be honest that as we start to see fewer definitive 1As, and my phone keeps ringing because that's what it does. Excuse me. We are starting to accept more of the grays because we've gotten through, the county, has gotten through the dentists and the physical therapists and all that have to be in person in a healthcare setting. And so we are loosening up the restrictions a little bit on who we judge to be in 1A. And so I'm trying to find the chat where the question was asked about decision regarding spouse giving care to the spouse at home. We're taking a second look at that. Last week we had enough demand from true 1As that we had to decline a couple of informal caretakers, but we're revisiting that as of today for the clinics that are coming up this Friday and Saturday.
So I'm going to say this now and repeat it later. The way that you register for a clinic is to go to a website. You can find this on Bainbridge Prepares or on the Senior Center website under the COVID news. It's covidbi.timetap.com. So COVID, Bainbridge Island, covidbi.timetap, TIMETAP.com. And Loren has just put it in the chat for those of you who are on the chat.
Correct. So Sandra, essentially, we are starting to lean towards just accepting, informal caretakers. So if you know of a situation like that, go ahead and apply to one of the clinics this Friday or Saturday.
So I would like to also, there's a question from Gary about Virginia Mason. And obviously a lot of people are talking with their healthcare providers, Kaiser Permanente, Virginia Mason, Swedish. We are fortunate to have Kimberly Garber here on the phone. And Kimberly works at Virginia Mason here on the island. And I know that the challenges of setting this up in a medical setting have been a little different than sort of what Loren's talking about. But can you give us an update from your perspective on how that's going and whether we should decide to reach out to Bainbridge Prepares or work with our healthcare provider?
Hi, Reed. Thank you so much. This is Kimberly Garber. I checked with the director of the clinic yesterday, Summer Shields, just to make sure that we were all on the same page. And, she said, I'm not sure that we have the information that you might be looking for right at this time, because the plans are changing every few hours. She said, they're actively working, they're right in the middle of planning. And the plans will hopefully get going next week. They're thinking sometime the week of January 18th. However, we are also waiting on the approval to move forward to the next phase, which is 1B. So we're, that every single day there's a new email that tells us kind of where we are. It won't be, you won't be able to register, as I understand it, through like the way you would register for online for an appointment with your primary care provider. It's going to be some sort of separate registration system, and I don't know what that's going to look like yet. I'm just trying to keep everybody informed as much as I can, and I'm happy to come back next week or, whenever you would like for me to come back to give you more information.
Well, all you have to do is tell us when you have something to say, and we will definitely welcome you back. But it does sound like from what you're saying that the anticipation is that the other question I asked earlier about 1B, which is people, at least at this point, who are 70 plus, and that may change too, I guess. But at this point, 70 plus in Kitsap County, that could come pretty soon. Could come in a week or two. Is that
Absolutely.
fair?
Yes, that's correct. I mean, that Washington Department of Health phase infographic that's at the departmentofhealth.wa.gov, doh.wa.gov is really good for people to understand where we are in the phases.
You go ahead, Loren.
So just to add on to the complications of determining when the county will move to 1B or B1 that Kimberly alluded to. One issue that all the current vaccine providers are running into is essentially assisted living facilities that have sort of been I guess you will, for lack of a better term, trapped in I'm sure everybody's heard of the Walgreens and the CVS rollout, where they've been specifically tasked by the federal government to go into these facilities. And we're hearing from about 20 times a day that the rollout of that is not progressing in the way that people would hope. And so we are, a number of providers, including us, are looking to fill in the gaps. But what that means is there are a lot of nursing homes and senior living facilities that have not been vaccinated yet. Their residents have not been vaccinated. And so if they are waiting a month for Walgreens to get to them, whereas the rest of us are moving on to phase B and phase C, there's just a disparity there that may end up being unfair. And so that's all being worked out as well.
So it might be that, and I know that you're trying to do this, if there are isolated locations, if a community group like Bainbridge Prepares can do a clinic to help a nursing home or an assisted living that hasn't been touched, you're likely to try to do that first before you open up B2 clinics in the spirit of fairness. Is that?
That's the conversation going at the county level. And it is not our call as to whether or not we can take B1s or not. We're waiting for guidance from the county, and we speak to them every other day. I'm just kind of indicating the struggles and the problems that are out there that, again, we're dealing with, and some of the other vaccine providers in this county and across the region are dealing with.
There was a note in the chat asking about a cost. There's no cost. If you're insured, then your insurance will pay. And so there's a lot of information asking about that. But there is federal government money allocated for people who are uninsured. So being insured is not a requirement to getting the vaccine.
Right.
And there was a question about where are the clinics. We are going to continue to use the senior center, and we're working closely with Bainbridge Prepares. You obviously can also reach out to your own medical provider. I know that the concierge medical provider on the island has been also delivering some helping with reaching 1A folks and other people in their practice. And it's important to recognize that that even after you get vaccinated, there's a lot that's not known about the vaccine, like how effective is it between the first dose and the second dose. So you basically need to act with all the same precautions that you did before you got the vaccine, certainly until you get the second vaccine, which with Moderna is 28 days, with the Pfizer vaccine is 21. And even then, we don't know whether you might be able to transmit the disease COVID to somebody else if you happen to come in contact with it. But that's because that's the way this thing has gone from the beginning. We have, they first told us we didn't really need to worry about masks. And it turned out, boy, that was that was wrong. And we may not, we also know now that that we're not as likely to get sick from surfaces as we feared in the first couple of weeks. So if somebody wants to keep up on top of this, I know, Kimberly, you mentioned the Washington Department of Health website. Are there other places that people should check? I know that Bainbridge Prepares has got a page up about COVID.
Mm-hmm.
Are you able to keep that up to date? Go ahead, Kimberly.
Well, I was just going to say the Virginia Mason website also has information. If you just go on to virginiamason.org, there's at the very top COVID-19 information. Vaccine.
And Kimberly, is there any reason that if somebody is a Virginia Mason patient, but there's an opening at the Bainbridge Prepares community website, they shouldn't go ahead and get a vaccine?
No, you should definitely go ahead and get a vaccine wherever you can get it.
Okay. Any other questions or comments from the floor?
Will there be appointments, or we just stand in line?
So why don't you describe sort of how the website works, Loren?
We don't want anybody waiting out in the cold and the wet in the hope of getting a dose 3 hours later. I'm sure you've heard about the problems in Florida and all that. So no, the website that I pasted, you can sign up for appointment slots. Essentially we have appointments every 5 minutes from for the clinics on Friday, for example, from 9:30 to around 4 o'clock. Many of them are taken right now by 1A folks, but essentially you pick your, an 11:15 appointment and you show up a couple minutes early, and we may ask you to fill out one or two more screening forms, and then we get your shot. And after that, we ask you to we monitor you for 15 minutes minimum after the shot to make sure you don't have any negative reactions, and then you're free to go.
Thank you.
One more thing is for anybody that has technical or mobility challenges, either registering online because of carpal tunnel syndrome or anything like that, or actually getting to our clinic. We've partnered with Island Volunteer Caregivers in order to assist with that, both calling people, taking down their information for entering it online, as well as doing what they do best, which is picking people up at their homes and bring them to the clinic. We've vaccinated dozens of their most active volunteers in anticipation of Phase B.
So Laura Van Dyke is on the call, and I don't know if you're able to open your microphone and talk a little bit about how people should contact you if they think that they might need help getting to a clinic.
Sure. Yeah. Thanks for saying that, Loren. I really appreciate it. They can call us at our regular number, 206-842-4441, and let us know if they need help registering, or if they need a ride, or if they want to just be on our list to be called to then work through this process as as 1B opens up. So we've reached out to all of our IVC care receivers to see if they have a plan, if they have someone helping them, or if they would like to be on our list. So right now we're just basically keeping a list, and then as we get more information, like Loren said, daily, we hear when who's eligible. Then we we'll contact the folks that we know are eligible that are on our list, and then help them sign up and get them a ride if they need it. So yeah, I just want to express my gratitude to Senior Center and Bainbridge Prepares and Community Pharmacy. A plug to like everyone change your prescriptions to community pharmacy right now, because what they're doing is so fantastic, and we're able to be second in the county because of them. So just my plug for Mark in that, because I really appreciate this, and it's certainly helping our care receivers, which is most important to us.
And I'm showing you the screen that you would log into at covidbi.timetap.com. You go through a couple of screens before you get here, but you get a time that would work for you. You put in that time, and then you answer some questions that would verify that you're eligible and what your insurance was. And then you wait, and you'll get a response from that team that Loren was talking about, because they'll check through and make sure that in their estimation you do qualify. Paul, you have a question?
Yeah, well, actually, just wanted to say that the Seattle Times today has a kind of misleading headline: Washington State caught by surprise as U.S. makes abrupt shift on coronavirus vaccines. And it seemed to imply that there might be a problem with our state's plan. But if you read through the whole article and get down to the end, it finally says the federal government's plan does not override, and Inslee himself says we're going to stick with our plan. So if you happen to see that headline, don't panic.
Kimberly, a couple of questions about Virginia Mason. One, somebody said they were told that that Virginia Mason on Bainbridge did not have the certification to give vaccine. You will be able to administer vaccines here when you get a plan, right?
Absolutely.
So you can definitely keep in touch with them about that.
Absolutely.
Okay. And then the second question was, do you have to be a patient at Virginia Mason to get a vaccine through VM?
I don't believe so, but again, I don't know how the scheduling system's going to work. How people are going to sign up. So I'm not sure how that's going to be pushed out into the world of the sign up, like the current one that Loren's doing with Bainbridge Prepares. Maybe it'll be similar. I don't know.
Okay.
That's the piece I don't know how to tell people to even sign up, because it's not been forwarded. That information hasn't been given to us yet.
Right. And Bob mentions that Kaiser has an entire resource page and providers for patients only. And there's a phone number there in the chat, 800-297-6877. And of course, as we've said, there's the Department of Health at Washington, and then the CDC has a lot of information. And there's also information on the Kitsap Public Health Department, Public Health District website. Hal, did you have a question? You'll need to unmute yourself if you do.
No, it was already answered. Thank you.
Okay.
I have a question. This is Jan.
Yes, Jan, go ahead.
So is Bainbridge Community Pharmacy the only kind of independent, the only one that has independent access to these vaccines? It seems like everybody else that is tied into a larger organizational structure that they need plans and approvals, but Bainbridge Community Pharmacy has gotten, a hold of these vaccines. Are they the only source now?
Hi, Jan. Good to hear from you.
Hi, Loren.
No, essentially the Kitsap Public Health has encouraged as many, providers as possible to register to be approved as vaccinators. But they want things to be done safely. And so, for example, there's a an ophthalmologist clinic up in Poulsbo who has been doing fantastic work on Saturdays after the clinic. You know, they don't have clinic hours for eye appointments on Saturdays. So they get through 100 people, you know, every week at their clinic. And it could be firefighters, it could be, you know, dentists. They're basically just saying, get in here and get a shot. But they have proven that they can do it safely. And so some of the folks that have registered to be vaccination providers haven't gone through the steps to indicate that they can do it safely and that they can report the immunization data to the state properly, and so forth. And so Mark and his pharmacies, both up in Port Hadlock and here, I mean, they do vaccinations, not at this scale, but on a regular basis for shingles and the flu. So they had everything in place that they needed to do vaccinations, but they just couldn't scale without a partnership with us.
But they're not doing any 1Bs at this point. Everybody's still in 1A, correct?
Everybody is still in 1A. We are not authorized to do 1Bs until the county says that we are authorized to do 1Bs.
Okay, thank you very much.
And obviously, as soon as we know that, all those locations we talked about, plus if you happen to be a member of the Senior Center or subscribe to our newsletter, I will be happy to let the word get out as fast as I can that those 1B appointments are available. Kimberly, did you have a comment?
Yes, Reed. Jan, hi, Jan.
Hi,
I just
Kimberly.
wanted to say that Virginia Mason has vaccine, and of course, it's being used for just 1A, and so they prioritized staff, and so they're still doing that. And I'm about to get my second shot later
But
today.
you're doing the Pfizer thing, and you have to go to Seattle for it.
Yes, that's correct.
When
So-
will you get the Moderna so you can administer here?
Well, that's what I'm waiting for my nurse manager and the director of the clinic to let us know when we are able to move forward. They haven't given us really any information, but they're working.
But do you anticipate getting I understand the Pfizer can only be administered in Seattle, but the Moderna you would be able to administer here. Do you anticipate getting the Moderna vaccine?
I think the answer is yes. I don't know 100%. I know that Dr. Cowan was talking about getting some vaccine, and I think he said it was the Moderna, but I cannot be 100% certain on that.
And of
Okay,
course, I'm
thank you.
guessing that the issue with Pfizer is just the super cold storage, which is not a function of anything more than what equipment is available on Bainbridge and between here and Seattle. So it's not. And that might have been the certification question earlier. Margaret Lilly, there was a discussion earlier about who qualifies. And it's, as Loren said, it's fuzzy about whether home care receivers who are unlicensed would qualify. And we're just, the group is trying to do their best to respond when there's availability. And if you are a home care provider and you explain that in your application for an appointment, you will be reviewed at that point. I think that's the best way to go. If you feel as though, given your circumstance, it makes sense for you to be further up on the line because of the exposure you're in, you're being encouraged by Loren to sign up at covidbi.timetap.com and explain the situation when you apply. We're going to have clinics here on Friday and Saturday this week.
Thank you, Reed.
You're welcome. Also, I saw that there was a question about if we signed up with state phase form. This is from Karen. Do we need to sign up with Bainbridge Prepares? I don't know what the state phase form is, but to get an appointment, the only way that you're going to get one with Bainbridge Prepares is to sign up with Bainbridge Prepares. So, and I don't think anybody right now is running a wait list, with the possible exception of Island Volunteer Caregivers for people who would have technical difficulties getting to register online. They don't have anybody to help them, or they don't have internet access. Then it would probably make sense to let Laura and the IVC folks know now, and their number is 842-4441.
Reed, you want me to answer a few other questions? I
Yes,
believe.
please do.
Okay, Sandra, about the booster shot scheduling. So our system is going to email about 2 to 3 weeks after your first shot for you to schedule your second your booster shot. Which is for Moderna, as Reed indicated, is about 4 weeks after your first shot. So we will be doing our first round of second doses or booster shots next week, and then we will be doing them continuously until we're all done with this thing. So
I want to know if somebody wants to help with this project. Are there ways, either Laura or Loren, that you're still looking for certain kinds of volunteers, and if so, how should they notify you?
Laura, you want to go first? Oh, you're
Please
muted.
unmute yourself.
Thank you. And then I realized where my camera is too. So that was helpful. For IVC, what we're doing is if you're an IVC volunteer and you'd like to help us with this effort, we'd love to hear from you. Right now we have plenty of drivers as far as we know, but we could use more help calling people. We're going to also reach out to the city of Bainbridge Island to see if they need more help calling other people that maybe. Our biggest concern are the folks that don't have email. So if you don't have email, that is signing up for this is going to be challenging. And so we want to make sure we have our folks. We have about 150 that we know don't have access to email. So we've reached out to them to let them know that we can help. Some people though have, family in the area and can help them. And so that's okay. And that's where we did our first round of calling just to see, are you okay? And do you have a plan or do you need our help? So that's what we're gathering right now. We don't think we have everyone on Bainbridge that doesn't have an email in our list. So if you don't, or someone who doesn't, feel free to call us and we're happy to help. So if you're an IVC volunteer and you want to help us make these phone calls, we'd love to have you. If you're not an IVC volunteer and you'd like to be an IVC volunteer, we'd love to have you too. So there's just a lot of moving parts maybe in the next month or so as we get through this. I don't have total statistics, but just a little bit of math. If we do open for 70 up on Bainbridge, it's probably 5,000 or 6,000 people who all of a sudden get eligible. And that's like, yikes, and what we don't want is anyone to get missed. So
IVC is Island Volunteer Caregivers.
Yes.
And they have been working here for years in helping to get people to medical appointments and helping with all kinds of respite care and just connecting with people around the island. And they're a great partner of ours as well as many other people. So thank you for stepping up for this. And if you also would like to volunteer at the Senior Center, we are getting a lot of phone calls right now, and we would love to have you help us answer the phones. Loren, why don't you talk a little bit about the Medical Reserve Corps and whether I need to be a doctor to be on the Medical Reserve Corps?
Sure. I'll actually grab one question that Edith and Robert chatted about. We're doing the Moderna vaccinations. We as Robert indicated, we don't quite have the capacity to do the ultra cold storage with the Pfizer. Mark, the owner of the pharmacy, and I were texting each other last night at midnight and then at 5 a.m, worried that if his freezer went offline last night because of the power outages, like, oh my God, what would we do? The Moderna is challenging enough, but Robert is also right that we've seen both for us and from our discussions with larger providers, including St. Michael's, the Moderna seems to have fewer negative reactions. Pfizer does, when St. Michael's, I believe, vaccinated their first 5,000 individuals, they had 14, kind of relatively serious reactions that required emergency care. And we've done 800, and we've had 2 or 3 minor reactions. And basically after the first day, everyone kind of said they have their own little story about how they were affected by the vaccine, but it's all pretty minor. In terms of moving on to volunteering for the Medical Reserve Corps, so is good and bad is that we have been flooded with requests to join. And Robert, that may be why your process is slow. Is it's sort of like having 100 people show up at your door and say, "Put me to work," and we need to background check everybody, and we need to kind of sort you into, are you still licensed to provide vaccinations? Oh, you're not. Okay, is there another role we can get for you? So Ann Lesage is actually, she says she's just doing nothing but printing badges and filing paperwork all day with the applications that are coming in. So it's not a matter that we want to be slow. It's a matter of there's 800 things going on at once, and it's just, it's we're getting crushed in multiple directions. Al was jumping in. Al was one of our first volunteers to do immunization data entry, and he's been fantastic. But still, I encourage you still to apply. We'll get to you if we can eventually. And we're definitely taking, especially currently licensed, RNs and doctors to help administer vaccines. And if you don't have the capability to administer vaccines, we have other roles that you can participate in at the clinic, such as registration and data entry and so forth.
Loren, can I just go back to just a general question? The guidelines changed for 1Bs to 65 and older, but I know that you're saying 70 and older. Are you going to the 65 and older or not?
Jan, that is not my call. Luckily, that's not my call. It is.
But are you still 70 and over? That your guidelines?
Oh, we are even 70 and over. Yeah, we are not in phase B yet. And so
we don't know, right? So we don't know what B1
okay,
is going to
because the
look like.
guidelines, CDC guidelines, or some federal guidelines changed to include 65 and older.
Yep. The news keeps changing as Kimberly.
Refresh the page. It's changed already, Dan.
Oh, okay.
So we'll, and the fact is that it's going to vary depending to some degree on the guidance from that Kitsap Public Health District and the coordination across our whole county.
So it's up to the county to interpret and take what they want. Okay.
Yes, and the counties are going to be moving in at different speeds. So, for example, I know Jefferson is going to be moving a little bit faster to phase B than we likely will be.
Okay, thank you.
And Al Kwan from the Rotary Club says that the Rotary on Bainbridge is trying to help coordinate volunteers, club members, and non-members. So you can reach out to them if there's some way that you want to help. And I should note that Bainbridge Prepares is not just for COVID. They've been doing a lot of work, as I said at the top, about earthquake preparedness, wildfire warnings, map your neighborhood. And so I think that that this is an example of why this kind of organization is so valuable. And if it takes a little while to get registered, no, unfortunately, there will be another need for volunteer organization. I think that's. I think that we probably touched on pretty much everything. I do want to let you know that that Rob Gelder and Health Officer Gib Morrow, Dr. Gib Morrow, are going to be joining us in about a month on the 10th of February to talk about how the Safe Start thing is going, and obviously give us an update on this. As we have more information, we'll put it on our website. If you're not a member of the Senior Center, I invite you to consider joining. It's just $20 a year, and we'll send you an email every week about what's going on, not only about this, but cheerier topics as well. Thank you very much, and I'm gonna wrap this up for now. But I really appreciate Loren and Kimberly, you giving us your time and all this information.
And Laura.
Thank you so much.
Yeah, and thank you, Laura, for being such a great partner. IVC is a wonderful organization. In many places, a senior center would be trying to do both of these jobs, and boy, I'm glad I don't have to do it all by myself, or we don't have to do it all by ourselves. We're grateful for the wonderful team at Island Volunteer Caregivers.
Thanks for your good work.
Thank